Mr. Speaker, according to the Canadian Mental Health Association, 1 in 5 Albertans will suffer from a mental disorder in his or her lifetime. Yet for 3 years, this government has ignored recommendations by the Auditor General that would advance implementation of an integrated provincial mental health plan. To the Minister of Health, how much longer are Albertans to suffer without the standards, targets and initiatives of a provincial plan for addiction and mental illness?
The Honourable Minister of Health and Wellness.
Mr. Speaker, as I've indicated on previous occasions, and I'm happy to reiterate it, we spend between $500 and $600 million on such initiatives. We've just committed another $19 million for a school initiative to hire more counsellors and provide more assistance. And finally, we do have a mental health provincial strategy that is being worked on. It will be available very soon, and it will result in vast improvements to mental health delivery in this province.
The Honourable Member.
Thank you very much. Back to the same minister. Given that Alberta's suicide rate is the second highest in Canada, why hasn't the minister acted on another 2008 recommendation from the Auditor General and increased the priority of suicide in the provincial mental health plan?
The Honourable Minister.
Mr. Speaker, I believe we have, but I should also comment that of the 53 recommendations that were made by the Officer of the Auditor General, the vast majority of those recommendations were acted on. They've already been implemented. And again, we are waiting for the Office of the Auditor General to complete their audit of what we did in response to the audit he did earlier. So it's a two-way street here, and it's being worked on.
The Honourable Member.
Thanks very much. Back to the same minister. Well, there's been no improvement on monitoring or reporting. So what is the reason that this government has made it so difficult to track their process on implementing the provincial mental health plan? Why? Oh, because there's no progress.
Speaker, I don't think there is a delay. I think there's a very robust, a very aggressive action being taken, partly because of the 5-year health action plan, mostly because of the 5-year commitment to funding, unprecedented anywhere in Canada. And I've indicated before, and I'll indicate it again, as far as I'm concerned, mental health is one of those top priority issues, and that's why we've put so much more emphasis on it. More resources, more people. We've just opened more residential and treatment beds in Medicine Hat and in Fort McMurray, and there's more good news